Well, good morning, everybody. I am Molly Kenny. I am one of the co-chairs of the Minnesota Coalition for Family Home Visiting. Great to see so many names and faces. Love it, love it, love it. It's great because we have been doing a lot of work to get people to these meetings and continue to kind of try to make sure that people feel welcome. So what we are asking, because it is such a large group today, is that you put your name in the chat. As well as the organization that you're working for. And if you want to just pop in, maybe, we try to do some kind of a icebreaker kind of thing, gets our brains working in different ways. If you want to put your, either your favorite springtime activity or a favorite plant, summer plant, and you can do both if you wish. So if you want to get started on that, that would be great. Thank you.
Yeah, it needs a little shiny. You need to put some black paint in a spot, I think.
It's
Shiny.
Linda, yeah, there you go.
Molly, will you announce again what people are to enter for those who've joined us after you made that announcement, please?
Sure, and welcome to those that are popping in now. I'm just asking that you put your name in the chat, as well as the organization you're working for, and either a favorite springtime activity or your favorite plant, summer plant, and feel free to do both if you want. So people are busy putting those in there, and I'm getting lots of great ideas. So this is awesome. So we'll get started in the next couple minutes.
Well, good morning. I think we should go ahead and start if you are willing to.
I was thinking the exact same thing, Laura. So Kati, are you going to take over with the agenda?
I think that's my turn. Okay, well, welcome
Okay.
everybody. I am so happy to have so many of you joining us this morning. Laura LaCroix DeLune, representing the Family Home Visiting Coalition. We have a really exciting agenda. We are going to just do some brief updates on some of the coalition work, and then we will be joined by our colleagues from both the Department of Health today and from the Department of Human Services today. So super fun. And when we meet new people, I'll just ask you to maybe take yourself on camera so that they can see you. It's always hard to introduce yourself to a bunch of squares with names. If you're willing to participate that way, you don't have to for my section because I know your names, but it'd be nice for those of you who are going to meet you for the first time if you could come on camera. So the Family Home Visiting Coalition, we just wanted to provide a couple quick updates. We have we are openly taking updates to the Family Home Visiting Directory. And so if you haven't yet done that, we would love to make those updates to your own programs. We know several of you have changed which type of family home visiting program you're offering. So we'd love to capture those changes in your in the newest version. And then we also know that there are some new promising practice grantees, and we'd love to capture those. So we're going to keep the directory capturing data through the end of this month and would then make it available on our website starting June. And the benefit of being in this online version is that people will, home visitors will go to it from time to time when their families are moving into different counties or different communities. And so then they can make a warm handoff. I know what it is used for different research purposes as well. When they did the MCFHV needs assessment for the state, which is our federal funding source, they were able to use that to access programs beyond those that are funded through the health department. So we encourage you to do that. And Kati, are you able to put that in the chat for people, that link?
Yes, I will.
Thank you so much. All right. And then the other piece that we wanted to provide an update on is for many of you who've been involved in the coalition in the last several years, you may have recalled we offered a training on unconscious bias and racism and the impacts on maternal and child health through family home visiting last year. There was some requests from those who participated in 2022 that we offer ongoing support, knowing that one training, it was a cohort training where there were, let me just back up. There were 4 months of training in person where we did half-day sessions. So we did cohort learning in 4 different locations across the state. And then we also did 2 different online trainings. Nidra Robinson, who has her window open or her camera on. Hello, Nidra, you can wave. She kicked us off in June. And then we had some training offered through Dr. Bonigo, who is a certified nurse midwife. And then Molly Kenny, you can wave, who was opening us up. She led the session on child attachment and mental health. So we had a really good session. We are updating that training and making it available again this year. Focusing a little bit less on the unconscious bias side and more around how bias and racism impact our ability to have strong relationships with families and impact mental health. And then the ongoing support will focus on how do we bring this change into our own programs, into our work with families, and into the organizations in which we work. So that's the goal. We are looking to you just briefly here, if you could help us out. We are looking for your suggestions on locations for 2023 to offer this in a cohort series. We will do one Twin Cities location. We're thinking somewhere in the North Metro, and then we will have 3 Greater Minnesota locations. So the locations we're considering right now are St. Cloud, Bemidji, Alexandria, Mankato, Park Rapids, and Marshall were the locations that we've been talking about. So if you would vote in the chat for your top 3 locations, we would really appreciate your thoughts and inputs. And a lot of it will be determined on who has space. So we're looking for a place, communities that can host up to 50 people in the meeting rooms and have some AV equipment so that we can continue to come back August through November. So again, we'd love your top 3 votes. And if it's the first time you came to this meeting and are hearing about it, we still want to hear from you, especially those of you who are in Greater Minnesota. Knowing the places that are easier for you to come to on a regular basis is super helpful. So again, we're looking at St. Cloud, Bemidji, Alexandria, Mankato, Park Rapids, and Marshall.
And I think the hope is that we have a southern location and a northern location. So we have to kind of sort through that. So it's going to be statewide.
Thanks for those of you who are starting to vote. Keep them coming in because that'll help. And then the other piece that I will say, Kati Gomez, who is our policy associate at LaCroix DeLune Consulting and doing the support of the lobbying efforts for the coalition, who is with us, is leading some of the planning for this. And we would love to have people join us on the planning committee. So if you'd like to learn more about the planning committee, we can give you a heads up. Let us know in the chat, and we appreciate those of you who have been able to make time to join us. And I will say, we do have a number of the MDH team with us, and if there are people on the MDH team at Family Home Visiting who would like to join the planning, you are more than welcome to do this. It's always helpful to get your input and your connections in the planning. Okay, so I'm going to just quickly shift over to, in the last couple minutes that we have here before we move on, quickly move over to the legislative updates. We are in the legislative session that is scheduled to end the 22nd of May. There are a number of proposals that are moving forward that the coalition has supported. We have talked about them at our last meeting, and I just wanted to make sure we provided an update to you. Kati put together this amazing side-by-side bill summary. Kati, do you want to pull that up while we talk through it? And I can just highlight a few things. What I want to make sure we highlight is the Family Home Visiting proposals that are out there. For those of you who may recall, we submitted a proposal to increase Family Home Visiting programs, and we aligned our proposal to the governor's proposal after lots of conversations with Noya, who is here with us, and with others at the Department of Health, and we've worked also closely with the Children's Cabinet. You have the whole slide deck. Thank you, Kati. So we wanted to make sure we give you an update on where we're at. The Health and Human Services Committee Conference Committee is meeting, and they, the House and the Senate had very different proposals on how they would fund Family Home Visiting. The House is proposing to provide ongoing, increased ongoing funding for Family Home Visiting at $5 million for the biennium. So that's $2.5 million per year. It is ongoing. And the Senate was proposing to meet the governor's request at $20 million for the biennium, or $10 million per year. The House and the Senate have a number of different provisions in the HHS bill that are not the same. And we are fully aware that that 20 million is not going to stay. And so as part of our strategy, we decided that we would try to let them know, if you weren't going to fully fund it at 20 million, that we would like to see some of our other priorities funded instead. So the coalition has more formally submitted a priority list to the HHS leadership to say we would like to see a minimum of $10 to $13 million stay for a biennial increase to Family Home Visiting. And we also suggested that they prioritized the doula workforce investments, which would be reimbursement rate increases, which you can see some of the details here. So we did ask them to prioritize that. The Home Visiting Coalition has been working closely with the Birth Equity Community Council to try to see this increase happen. The benefit to this, this provision is that doulas would be able to seek reimbursement rates similar to private pay. And we know that the benefits, the health benefits are so positive for um, parents when they're pregnant and for the child. So the health outcomes are really positive. We'd like to see this funded. And then there's the MPI requirement. So we're putting our support behind that as well. We also were suggesting that they fully fund the Community Solutions Grant at the House provision at $10 million. There were a number of, well, there were two of the Community Solutions grants that were made initially that focused on family home visiting. The Community Solutions grants are focused on prenatal to age or grade 3 solutions, where communities of color are able to identify, or communities at large are able to identify challenging issues, and then they identify solutions. So 2 of the Community Solutions grants were focused on offering new family home visiting programs. During that time, they were able to build their capacity in their community, and then they were able to focus on quality improvement, and happy to report at least one of them has now been a grantee for the new Promising Practices program. So this is a nice feeder program, we think, for some of the family home visiting work that's happening in communities. And then the infant and early childhood mental health policy language is something that we suggested that they adopt, which would allow families to access services while the full DC 0 to 5 assessment was completed. As you know, we've been talking about the increased needs of infant and early childhood mental health across the board for both moms and infants and young children. And so this is a policy solution that we're suggesting. The Senate was suggesting to provide funding for consultation services, and instead we recommended that they put the money into services because it would help cover co-pays for underinsured, potential transportation. The consultation is incredibly important, but right now we know access to services is the greatest challenge. And then the only other one I'm going to highlight quickly, because I want to make sure we have time for all the other pieces, is the continuous eligibility for medical assistance, which is timely for our discussion, our next discussion on today's agenda. There is a proposal that we've been supporting is the continuous eligibility for medical assistance for children ages 0 to 6. So the policy is in both House and Senate. It would allow eligibility to be established for 12 months and continuous up to age 6. There is precedent for this. There are a couple states who have now passed this as well. The benefits of doing this, of course, are to help more children have access to the important primary care needs in those first 6 years of life that will really give them a better start long term. And we know this is something that you as home visitors or leaders in the field have been promoting and helping families stay connected to. So there's a strong sense that this proposal is going to go through because it is in both bodies. Kati, is there anything else on the, if you want to go ahead to the next slide, is there anything else that you would like to make sure we highlight in the slide, the side by side? We do have additional materials on childcare and other maternal and child health priorities like Help Me Grow. And is there anything else? I know you're trying to pull that up. Or maybe we can pause and see if people have questions while you try to pull that back up. So if there are no questions, what I would like to ask is your help in advocating for these provisions. We would be happy to follow up in an email, letting you know how to be in touch with our elected leaders. And again, just a reminder for those of you who work in public agencies, you always have the right to contact your own legislators. You are a content expert, and they rely on content experts and community members to speak about the needs of the families you serve. If your elected official knows you work at a specific county or a city or a state agency, all you need to do is say, I'm not speaking on behalf, formally on behalf of my agency. But I wanted you to know as a constituent, these are the things that matter. So, and Nancy Jost is with us, and Nancy Jost is a rock star at doing this. Nancy, could you just, for example, say why it matters? I'm putting you on the spot completely.
That's okay. Well, it matters because usually the people that we are trying to support and are working with don't often have the time to have their voice heard. And if you're working with children, they don't really have a voice yet. And so we have to be that voice for people. And I just think it's so important. And I think it, for some of us who work in agencies or organizations, you feel like, oh, I can't because I'm doing this job. But as a content expert, as Laura said, you can, but you can also do it as a person, a private person on your own time, like, in the evenings or whatever. And I just think it's so very important. And legislators can't know about every issue, like that comes up, like there's thousands of pages, I think, or 1,000 pages in the omnibus bill. So there's no way they can know everything. And you guys are the smart people that they need to rely on and really not only need, but seek out. I just had an email from a legislator a week ago asking my opinion about something. And it was because I happen to be an expert in the early childhood field. She isn't. She's an expert in lots of other things that I'm not, but she was looking for advice from somebody who knew. So it's just really important for us to make sure our voices and the voices of the people that we're working with and for are heard.
Thank you,
Well,
Nancy. And I just want to echo that. I absolutely love calling my state representatives and senators, which sounds, I know, a little bit out there, but I do find a lot of joy in getting to know the legislative assistants and informing that relationship, because there are representatives, there are senators, so they work for us, and so that's always the mindset that I adopt. And Nancy gave me this good tip when I was starting off this session, and that was call after hours if you don't like phone calls. And I think that is a great advice if you don't want to talk to anybody. Just leave a message. And Carrie, we can answer your question before I hop in on two other things I just am very excited to share with you all.
Yeah, thank you. I also want to say, if you ever feel intimidated to drive down there and talk in person, we have found this year, especially these one-page education things have been very, very helpful. So outlining the issues, giving a little bit of education on the problem and a little education on the solution and why it matters. If you do get to talk to them, it can be great talking points, and it can be something that you can leave behind. And if they're not there, and you make lots of copies, you can just start handing them out like it's a business card, or slipping them under doors, or giving it to them like it's a gift, right? Like, I want to give this to you, right? And when I wrote in the chat that they don't often know what they don't know. Earlier in the session, we had a chance to meet with a legislator, and this is just so important. It was a learning moment for me when he said his wife was a teacher, his daughter could not find quality care and quality early learning programs, so she started her own thing. She was a psychologist. She left the field, started her own thing with her family, and he sounded very proud, like, oh, she's a family child care provider. She has her own thing, and she's connecting with, you know, different resources in the community and all this stuff. And then he said, well, and they want my wife to quit her teaching job and come, you know, over there to support the program, but she can't. She has to work. And it's like, okay, so in one breath, this guy sounded like he fully got it. And in the next breath, he basically said early childhood providers are not working. And his wife can't leave teaching because she has to work, right? And so I think there's always this knowledge gap with some of our legislators, and that's why those conversations matter. Home visits break isolations, we know that. So know the things that you're passionate about when it comes to home visiting, put it on paper and go find those knowledge gaps, which are with our legislators, because it's really important for us to stand in those gaps.
Absolutely. And if you need a one-pager on family home visiting, we got it. So after I'm done screen sharing, I'd be happy to put it in the chat. And also, if anybody here would like help, you know, doing that in-person outreach, also put that in the chat or reach out to me, and I am thrilled and happy to help set that up or make a connection for you. Okay, so the other policy updates I want to run through. Apologies for the screen sharing bug earlier. So ECFE, early childhood family education, we know some ECFE does do home visiting, and I just really want to uplift their success and the policy in their policy journey. They both, while the Senate does have a little bit more money, ongoing money for ECFE. I know they were really pushing for, maybe somebody here on the call might know a little bit more than I do, but they have really been asking for 2 full-time employees to help with that statewide organization to improve coordination across the state. And so that looks like they will, that looks secured in the budget right now. And then also an increase. I believe this increase is tied to the MDE base, or the Department of Education's base. So it will now begin to increase as funding for education increases as well. So really want to highlight that. And the other one I really wanted to highlight that will be a big impact to us as a field, because it will be impacting our the families that we work with, are the early learning scholarships. So this is a pretty significant investment. So early learning scholarships, some key things that they are doing on the policy side is that they're expanding eligibility for these scholarships for children 0 to 5, all children 0 to 5, and prioritizing that 0 to 3 age range, which is huge when we talk about financial security and families. You know, when they're the youngest, when your children are the youngest, is when you have the less spending capital and disposable income, and I'm sure many of you know. And so that will be a huge investment, I think, into the families in Minnesota that really need it the most. And as well as they are prioritizing different groups of people. That includes families with 1 or more parents are involved in the justice system, in mental health treatment, or substance use disorder treatment as well. So I just really want to highlight that as something for the families that we work with. And then the other one I wanted to talk about is the child tax credit. So this is something I know the Minnesota Budget Project has really been leading on, and I can put information in the chat if people are interested in taxes. So this child tax credit in the House, also known as the working family credit, is an investment in. So if you all are able to mute yourselves for just a quick second.
Yesterday was Wednesday, Tuesday.
Thank you. And so this investment in both House and the Senate are very robust. And I just want to highlight a couple of differences that each one has. Both child tax credits are fully refundable, income targeted. There's no minimum earnings required, and does allow families using ITINs to access these resources. I will highlight that the House proposal, because it is more targeted for children with those lower income families, is estimated to reduce child poverty in Minnesota by 25%. But if you look here, you can see that is because some of the different income limit provisions that have been put on there, and then the amount of child tax credit per child. So in the Senate, it is a set number at $620. That dollar amount is $620 as a child tax credit, whereas in the House, it can be about $1,200. And I believe that they're stackable on families, but there's there's more restrictions on that. And so this will, again, not only you all, but the families that we work with will be greatly impacted by this if it passes. And so odds are what will come out of this, out of a conference committee and negotiation, will look very different than what's on the screen, or probably won't be as robust as the House as the House proposal, and probably more targeted than the Senate proposal. So I will keep you all updated as we learn more. But I wanted to share those couple of key things just because it really pertains to the field that we work in. And if you have any questions about policy, again, please reach out. If you want a one-pager, I've written plenty of letters that I am more than happy to share with you all.
Thank you so much, Patty, Laura, Carrie.
I think Kathy had a
Great
great question.
Oh, sorry. Okay, go
Oh.
ahead.
See, I have a question about virtual visits, if they're going to continue to be covered after the public health emergency. Do we know that answer?
Yes, while it has not passed yet, I will say that it is comfortably and solidly included in both the House and the Senate. So, and I know there's a lot of, including us, but there have been a lot of other interest groups that are interested in seeing that continue as well.
Thank you.
Any other
Okay,
questions? before
Molly,
we
now
move
your
on?
turn. Yep.
Okay, I was just going to say, is there any other questions before we move on to our next part of the agenda? And Kati is really, really serious about, she's very open to, they are very open to lots and lots of support and providing kind of basics or intermediate, whatever it is you need. They are very, very, very accessible and love this work. So Nancy, thank you too for all that you've done over the years and for giving us kind of a roadmap for how to do this. We continue to get better. So great work on everybody's part. It's now my pleasure to introduce Noya Woodridge. Sorry, Noya, I'm not sure what your pronouns are, but Noya is our new family home visiting section manager and at MDH, and has given us lots of time so far, and has offered to share some of her ideas and goals along with her team that is here. And just hoping, Noya, if you wouldn't mind introducing the other team members that you have with you today, if they're on the call. So, and then if you want to just, hopefully we'll have some time for question and answer, but if you want to take it from here, Noya, thank you again. Really, really appreciate it. I know you have a lot on your plate, so giving us some
Molly,
time.
I'm sorry. Can I just do a quick correction? I'm sorry if I put this down wrong on our talking points. Noya is the division director, the Child and Family Division Director, and will be introducing us to the new section manager for family home visiting. So I just wanted to clarify that.
My
So,
apologies, Noya.
yeah.
I am so sorry.
No worries whatsoever. Yes, so I am here today.
Humility is a gift.
Yes, I'm here to introduce two new folks. And I do see several names of folks from the family home visiting section on here. So I don't know that I'll be able to pull them all out, but I'll start with Jenny Lippert, who is our new family home visiting section manager. Jenny comes to us from Candy, Ojai County, where she was the director of health and human services there. That included public health, income maintenance, accounting, child support, mental health, substance use disorders, child protection, child welfare, and home and community-based services. She has a master's degree in health and human services administration from St. Mary's and a bachelor's degree in healthcare management from North Dakota State University. She lives out in Wilmer, and she started with us last week on May 1st. She has, she's married, husband Tom, and she has 2 kids. And they, like I said, live out in Wilmer together. So, so happy to have Jenny on board. It took us 2 rounds of accepting applications and doing interviews, and finally able to get someone started for about 4 months after Dawn left the section. So I did see that Jenny has her camera on. If you can give a quick wave, Jenny, and then I'll introduce Amy, and then I'll let you all say a few words if you'd like. In the theme of stealing people from counties, Amy comes to us from Hennepin County. She has been she's supervising our state initiatives unit within the family home visiting section. So Amy is not replacing anyone. This particular supervisor position has been open for close to a year. Dawn and I had decided not to fill it right away when the last person left. And then when Dawn decided to leave, we thought we'd wait to fill the supervisor position at the same time. So glad to finally get this 3rd supervisor position filled in the family home visiting section. Amy comes to us, though she comes to us most recently from Hennepin County. She has been working in and around home visiting, family home visiting for years. Both here in Minnesota, but also in other states, Nebraska and Wyoming. Primary among those at Hennepin County, she was working on a joint home visiting project between public health and child protection, child welfare. So she has years and years of experience in this area. She has a particular interest in infant and early childhood mental health and the impact of poverty and intergenerational trauma on families. She has 3 children and 2 golden doodles that she likes to spend her free time with. So there we go. Again, welcome, Jenny and Amy. And if you would each like to say a few words, I think that would be great.
Good morning, everyone. Thank you for the warm welcomes. I'm excited to begin in this new role. Really nice to see all of the folks joining today, and I really look forward from the Department of Health to continue to build on these strong collaborations and help us move family home visiting forward and supporting the home visitors that do this crucial and vital work here throughout the state of Minnesota. So I look forward to getting to know each of you further as we continue our partnerships here as I am new to my role here with the Department of Health. So thank you.
Thank you, Noya, for that warm welcome and introduction as well. I'm seeing a lot of familiar names and faces here, so I'm feeling very welcomed and well supported in this community. So I really just look forward to continuing in this role here at MPH and helping to build this team back up and providing the infrastructure that you all need at the local public health level. It's nice to see you all.
Would we, could we just ask I know that there are a number of family home visiting section members here with us today. Could we just quickly ask you to also come on camera and introduce yourself? We have a number of people joining us around the state, and it would just be lovely to take advantage of having you here as a team.
I see Katie, I see Kristen, I thought I saw Chandra.
I was gonna say, I'm not afraid to go first, Noya.
Yeah. Yep.
Good morning. My name's Katie Spray, and I am the MCFHV grant manager here at MDH in the Family Home Visiting section. I actually came from MVNA, where I was working with Anna Mueller to program manage our programs there. And I've been with the state for just over a year. I started in March of last year.
I can go next. I'm Chandra Bittman, and I'm the Community Initiative Supervisor. And nice to see a lot of familiar faces today. I'll pass it over to Kristen.
I'm Kristen Thoraldson. Just got a promotion, woo, 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 to Community Initiatives Coordinator. Also still working in my role as Tribal and Nonprofit Grant Specialist, and working to roll out the Promising Practices programs.
I think that's it, if I'm
Nope,
seeing
nope.
all the names on my
We have our
screen.
new mesh coordinator here too.
We don't have a mesh coordinator right now. That position's currently vacant. I've actually been working to cover it with one of our new practice
My
advisors.
mistake. So sorry.
My name is on here twice because I sent it to one of our new practice advisors.
Oh, very good. Okay.
To join us, and that is Lindsay Kraus. She is here joining us from Crow Wing County. She's not going to turn on her camera. She is at an appointment, joining us from an appointment right now, but she was a home visitor up at Crow Wing County implementing mesh and really leading some of the mesh implementation work there. So that is Lindsay.
And I think Michia is on too.
Yes, I might be the last person. So my name is Michia Tao Seichao, and I am the MCFHV coordinator. Happy to be here.
Well, thank you all for being here. We did want to give some time for our home visitors to see if you had questions that you'd like to ask of your team at the health department before we turn it over to the next agenda item. We still have a couple minutes left, so. And if not, I always have things that I would like to share. You all know that about me. I do want to just take a moment to highlight that we have, we've been really fortunate to have participation across the state. So for those of you who haven't been at our meetings, prior to the pandemic, we used to offer meetings in a hybrid format so that people in greater Minnesota could participate. I'll just tell you, it's a great advantage to bringing people in from across the state to better understand how family home visiting is being implemented, what are some of the challenges, what are some of the opportunities for improvement. And then we also represent a number of family home visiting programs that are not solely funded through the health department, but we also bring into the broader umbrella our partners through early childhood and family education. So there's a number of family home visiting programs that are offered through family home visit or through ECFE, and many of them have been working in partnership with local public health. Others have been working with nonprofits, and then others hospitals. So for example, I don't know if anyone from St. Louis County is with us today. I don't have your county. Is there somebody who is here? Oh, if you want to speak up, I just want to highlight that through your work in St. Louis County, there's been a lot of ECFE has been partnering with the public health agencies and then the childcare agencies and helping try to offer more universal care to every family. I don't know. Do you want to talk a little bit about what you're doing up there with your ECFE, or I don't have to put you on the spot. I just want to make sure. Okay, I will, I don't want to put anyone on the spot. So let me just also highlight, in addition to the ECFV programs, we also include early Head Start family home visiting. So there are a few of the programs around the state who are doing that work through through Head Start, and then we have a robust representation from the nonprofit partners who have been doing this work prior to the legislation that was implemented to allow for promising practices or to allow nonprofits to seek funding directly from the Department of Health. We saw private philanthropic support for the nonprofit partners. As we're growing the state investment, we're seeing more and more of the nonprofit partners showing up here. So we are super excited that your team in family home visiting has grown to represent who's at the table more holistically for us as well. Through the coalition, we do public policy work, but we do a lot of the coordination and capacity building work for the field across all of those types of programs. Anything else from our leadership team that you think we should share with our colleagues? So we meet quarterly online. We had discussed meeting in person or hybrid again. The preference was to continue to meet online. It's just a more affordable option. And so we meet quarterly online. We'll do these trainings that you might have heard us talking about, where we're looking at bias and racism and how it impacts maternal and child health, and what we can do about it as individuals and as programs. So those are in-person trainings, and then we do our policy work. And you are always welcome to join these meetings, so we'll make sure that you learn about them. And then we will likely be reaching out to some of the leadership to bring you together and do a deeper dive into the coalition's work. So welcome to all of you who are new, and so great to see the team expanding. For those of you who've been around, I'm sure you are very grateful to have a larger team. Right. Okay, well, I think we can move on, right? If there are no last call for questions or comments.
Okay, thanks, Laura. I'll take over. Thank you and for being here today. And we're going to move into the next agenda item, family home visiting, unwinding the public health emergency. The coalition has asked to share important information with families on medical assistance in Minnesota Care about the unwinding of the federal public health emergency and the actions they will need to take to keep their families on health insurance. We are joined today by colleagues from DHS, Helen Gabri, our Community Relations Director, and Gina Savage, Health Policy Specialist, who has come to share information we can use as home visitors to help families keep their health insurance and on Minnesota Care and medical assistance today. So I'll let them get on screen. I see Gina. Welcome.
And
Thank
Helen.
you.
Yep.
Oh,
Yes,
got you both here. Thank you for coming, and I'll let you guys go ahead.
sure. And I think Laura's pulling up the PowerPoint. Thank you. So I know I don't know if you can do the presentation style or not, but that's okay.
Oh, let me stop the share and try one more time.
Well, while you're doing that, I wanted to say thank you so much for inviting us to your meeting. I know some of my colleagues at DHS are familiar with this coalition, but I had the opportunity and the pleasure of meeting Laura last week, I believe it was, and learning about the work of family home visitors, and in the work that I'm doing related to the public health emergency unwinding. and also specific to my role within DHS as a community relations director, we're helping to support the outreach and engagement aspect of this initiative, ensuring that we're getting all communities, and especially priority communities that are underserved and under represented, to ensure that they are aware of this change and can take action. And so it's with that in mind that we're here today to share this information. As you're pulling the PowerPoint up, I know Gina Savage is here as well. She's a healthcare policy specialist within DHS. And so we'll be tag teaming. I'll just do maybe a quick introduction, but no worries.
I'm sorry. I'm embarrassed to say this because I'm recording this session, but I cannot get it out of the presenter option. So if somebody at DHS has the ability to do it, I can share the screen. Otherwise, I'll share it in that format. I'm sorry.
Oh, no worries, no worries. That's yeah, you can share it however way. My second screen is not working, so I probably would not be a good candidate to share. Gina is here. I don't know if you'd like to, but I can start while you're doing that.
I can try.
Gina, do you want to try quickly?
Yeah.
Okay.
No worries.
Or Flower, you sent it as well, so okay.
For what it's worth, we're ahead of schedule, so take.
Okay, great. And hopefully it's more of a conversation as well, because we, again, are asking you to partner with us. And so really, we see this as an opportunity in your role as family home visitors, and I believe also trusted messengers within the families that you work with, that we could partner with you to help educate families and pass along really necessary resources so that they are better prepared for this next phase of the public health emergency unwinding, and so that we can ensure that eligible low-income Minnesotans on public health programs like Medicaid, also known as Minnesota or medical assistance and Minnesota Care, can keep their health insurance. So just kind of focusing in, this is really what our intent is, getting families and communities armed with the right information so that they can take action, and especially those that are most vulnerable. So with that being the case, we're here today to share some resources and tools that are launching or have already launched, so that we can ensure that Minnesotans can keep their health insurance. And as you know, due to the fact of the public health emergency ending, annual eligibility renewals will be starting. So this is really, again, the first step of a 12-month partnership that we're seeking with your coalition, so that we can prevent gaps in eligibility and service or insurance coverage. So that's really what we're here to discuss today. I'll pass it on to Gina, who's going to walk us through the rest of this information that we have to share with you.
Sorry, I am also struggling. Are you seeing all of the notes?
No.
No. Okay.
You're good.
Great.
We're seeing the slides along the side, so it doesn't look like we're on kind of your we're not in the presentation mode so much as, but we're seeing the content, and that's what matters most.
Okay. Well, I think this is probably as good as it's gonna get. I'm sorry. I also.
But if you exit the presentation and then click under the slideshow tab, there's a checkbox you can uncheck that makes it so you don't use presenter mode.
Okay, so if I what do I need to do?
If you
exit.
If you close out your presentation, if you end your slideshow, and then click under the slideshow tab there at the top, then should be a box about use presenter mode or don't use presenter mode.
Sorry,
But we are seeing the content, so
Okay.
it doesn't. We're good.
I'm just gonna,
Yep.
I'll move forward. Okay, so As a reminder, like all states, Minnesota maintained a healthcare coverage for all Medicaid enrollees during our COVID-19 pandemic. Since March 2020, Minnesotans who newly gained eligibility or already had eligibility for MA or Minnesota Care have remained enrolled regardless of most changes that would have previously affected their coverage. Continuous eligibility has helped Minnesotans during this global pandemic. It's helped the state maintain high insurance coverage rates. It's allowed us to receive billions in additional federal funding under the Families First Coronavirus Response Act. The Families First Coronavirus Response Act was the first major federal stimulus package that was passed by Congress, and it required that continuous coverage provisions end when this with the end of the federal COVID-19 public health emergency. With these continuous coverage in place, enrollment in MA and Minnesota Care has grown by more than 360,000, or about 30%, to an average of 1.5 million people during the pandemic. So essentially 1 in 4 residents living in Minnesota now get their healthcare coverage through these public healthcare programs. Congress passed the Consolidated Appropriations Act at the end of 2022, and that ended the continuous coverage requirements effective March 31, 2023, and requires states to return to standard eligibility procedures in Medicaid. For our medical assistants and Minnesota Care enrollees, they are required to have their eligibility reviewed once every year to ensure that they still qualify for insurance. This process is called the renewal. More than 1.5 million Minnesotans on medical assistance and Minnesota Care will need to have their program eligibility reviewed through the renewal process by May 2024. DHS is committed to ensuring that eligible Minnesotans keep their public health coverage when renewal processes resume as required by the Consolidated Appropriations Act. Maintaining health insurance for eligible Minnesotans is a top priority for the state, and our goal is for 0 eligible enrollees to lose coverage. So on that note, several important new protections are now in place to help enrollees keep their coverage while renewals resume. We've added more user-friendly ways to complete the renewal process. For the first time, Minnesotans will be able to upload their annual renewal documents online. Enrollees can also complete the renewals by mail, fax, telephone, or drop them off in person. We are making it easier to complete the paper-based renewal forms. We've included information about how navigators can help, how you can reach a navigator. We've removed questions that are unlikely to change, such as the Social Security number is no longer on this renewal form. We've added questions that allow enrollees to select that they have no income and then skip the rest of the income questions if they attest to having no income. And we are also training eligibility workers to continue renewal determinations when certain questions are left blank. And we're calling this our renewal checklist. We are checking enrollees who are losing coverage. We are checking their eligibility under all other eligibility categories to see if they are eligible under another basis, if they're losing the one that they're currently on. We are renewing coverage automatically for more enrollees by allowing them to skip paperwork and renew their coverage based on trusted data sources to show that they continue to qualify for MA or Minnesota Care. For example, if we know that the enrollee is eligible for other low-income programs such as SSI, our Supplemental Nutrition Assistance Program, SNAP, TANF, we can assume that they will remain eligible for Medicaid. We are working with contracted health plans to help maintain coverage for those eligible enrollees. We're giving health plans the data they need to do the outreach. And we're also trying to minimize the unnecessary hurdles to the renewal process that cause enrollees to temporarily lose program eligibility, reapply, and then regain that eligibility in a short amount of time. So to reduce that churn on and off of Medicaid, we are waiving the asset test at renewal for enrollees who have disabilities, who are blind, or are 65 or older, by disregarding assets that are above the asset limit until their next renewal after renewals have resumed. We are verifying program eligibility for enrollees who have disabilities, are blind, or age 65 or older after they submit the renewal form through manual back-end data checks. And lastly, this is not new, but I wanted to emphasize that people know that enrollees are allowed to submit the renewal paperwork up to 4 months after their coverage closes if they close for failure to return that renewal paperwork. So MA allows for retroactive coverage up to 3 months. So if someone submits their renewal paperwork within the 4 months following that closure of the renewal, they can actually get backdated coverage, all including the month that they submitted, those 3 months, all the way back to that date they were closed. So those are some of our important new protections. So we've also gotten some legislation to help eligible Minnesotans retain that access to MA and Minnesota Care when those pandemic-related continuous coverage ends and renewals begin again. So by allowing MA enrollees to we are allowing MA enrollees to maintain coverage until their first renewal during the unwinding period. The legislation also includes funding to support partners who help us do this work. Navigators will be getting funding to help enrollees complete the renewal paperwork. As trusted community organizations, they play an integral role in helping Minnesotans both apply for these healthcare programs and renew their coverage. County and tribal agencies who also help with renewal work will be sharing in a $36 million appropriation to help them carry out this work successfully. The legislation also works to prevent gaps in coverage. While automatic renewal functionality is being put in place for this population, those in our first batch of enrollees who are due for renewal, which is our July, since the protections ended March 31, our first renewal group will be the July 2023 cohort. So for those who are in the first batch of enrollees, that July 2023 cohort, they will maintain coverage for all reasons other than an ineligibility determination. So enrollees who have a disability, are blind, 65 or older, can keep their coverage if they fail to submit or complete their paperwork. Their renewal will just be rescheduled for a later date. We're also waiving Minnesota Care premiums for all enrollees from May 2023 through June 2024. And this legislation cancels unpaid premiums that were accrued during the public health emergency for MA for employed persons with disabilities, MA EPD, and then our Minnesota Care enrollees. Other requirements of the legislation include DHS must offer fair hearings and appeals as recommended by the federal legislation. DHS receives more funding to add administrative resources, including temporary staffing, overtime pay, support for contracted workers or a vendor, a rapid response team, and increased printing and postage needs. And then lastly, the Human Services Commissioner has received authority and flexibility to temporarily adjust eligibility verification requirements to ensure a timely renewal process and then avoid a loss in eligible coverage and respond to evolving federal guidance. So lots of stuff happening up at the legislature to give us flexibility and support while we begin this unwinding process. So, like I mentioned, our first group of renewals is July 2023. Renewals for MA enrollees take place on the anniversary month of your application. So that's 1 year following the month you applied. So this creates 12 monthly cohorts or groups of Medicaid renewals. This helps manage the large volume of renewals that are processed, which, as I mentioned earlier, is more than 1.5 million people. However, it does make it confusing for enrollees to know when they need to take action to keep their coverage, as opposed to Minnesota Care, where everyone renews for January 1. So since it can be confusing for an MA enrollee to know when the renewal date is, in the coming weeks, DHS is going to launch a renewal date lookup tool to help overcome this barrier. Enrollees can enter in a unique identifiable information to understand when they should watch for their mail and complete their paperwork. Family members, navigators, community partners, folks like yourself can assist enrollees with this tool to help. The first group of Minnesotans due for the renewal is about 100,000 medical assistance enrollees with the July renewal date. They will get their renewal information mailed to them. Probably has already been mailed out. Most enrollees will need to return a renewal form. However, some may remain eligible for coverage based on electronic information where we were able to verify their eligibility. In those cases, coverage will be automatically renewed, and enrollees should watch for an automatic renewal notice. An example of the renewal form for most enrollees is on the screen, and it can also be found in the communications toolkit page of the Renew My Coverage webpage. An example of the automatic renewal notice is also posted. And at the end of the presentation, I can link, I'll drop a link in the chat to show where you can find the communications toolkit on the Renew My Coverage webpage.
Just added that, Gina, just.
Oh,
so you
thank
know.
you.
Yep. Mhm.
Thank you. We have also, we have some new communication materials available that you can use to spread the word on renewals. We have 15, 30, and 60-second videos available in English and Spanish. And they look like this.
Make sure Medicaid's got you too by keeping your contact information up to date. Have you changed your phone number or email address in the last 3 years? Have you moved? Then make sure your health coverage moves with you. Update your mailing address, phone number, and email address so we can reach you and you can keep your health coverage. Don't wait. Update your contact info today. Keep your health. Keep your coverage.
And if you're looking to utilize some of these videos, those links will also be found in the communications toolkits page. So the DHS has created what we're calling a one-stop shop for all things MA and Minnesota Care renewal related. This can be found at the mn.gov/DHS/renew my coverage. This page is constantly being refreshed with new information, new design. Enrollees can visit the site and sign up for email updates to get the latest news, learn about text messages, get answers to any kind of questions, watch a video on how to complete the renewal, understand next steps when they will receive the renewal in the mail, and look up when to expect the renewal. The link to upload your renewal form, it can also be found on this page. And then as additional information becomes available and usable, we'll be adding information to this page, including that the forthcoming renewal date lookup tool that I mentioned earlier. So we've heard a lot of feedback in forums about how adding an attention-grabbing renewal envelope can be an easy tool to get enrollees to notice and take action on the renewal paperwork. Our healthcare operations team was quickly able to make an addition to our renewal envelopes to make them stand out in the enrollee's mail. So on your screen, you can see an example copy of what the renewal envelope looks like. It's also in the comms toolkit on the Renew My Coverage webpage. We are asking enrollees to look for the circle in blue when it's time to renew. We will have a new webpage outlining steps to take once the renewal information is received. We are also looking into campaign materials we can develop to highlight this strategy. It's one of the many ways that engagement with partners and stakeholders is making for a better renewal and communications process. As a reminder, there's a host of materials available for our community partners to use in the communications toolkit. We want folks to use these to amplify the importance of updating addresses and contact information so folks actually get the renewal packet in the mail and we can reach them when it's time to take action so that they can keep their insurance. Materials include a host of digital assets with banner ads, social media posts, flyers, postcards that can be emailed. They're also available in multiple different languages, including Hmong, Somali, Spanish, Vietnamese, and Russian, and can be co-branded. Previous partner feedback has mentioned that you'd like materials in Word documents as well. So we've added Word documents to the address update communications toolkit for the postcard, the rack card, flyer, poster, and we are now ensuring that new non-digital designs we post are available in other file formats. We'd love for you to take a look at these and determine if you can use them as soon as, now, because renewals have started. And we're also looking at the possibility of providing you with printed version of these tools. We've added additional communications materials for the address update campaign that have been added to the communications toolkit. There are more sizes of design materials to choose from, as well as more photo options. And we are working on getting these available as Word documents at the moment. An exciting new development is that DHS will be able to add text message enrollees when we mail them the renewal information to help them watch for it and remind them to submit their paperwork before the deadline. The messages will be coming from 28343 and will be starting soon. Ads will run about this new capability starting in May in the Spokesman Recorder, Access Press, Hmong Times, Latino American Today, Sahan Journal, Somali America Today, and The Circle. These ads will run through June, and all the graphics, including PDFs, JPEGs, and Word documents are available for you to use and share now in the Communications Toolkit on the Renew My Coverage webpage. So far, our renewal resources in the toolkits have focused more on targeted communications with enrollees to use at the time of the renewal. However, more general resources for any partner or stakeholders to use to communicate about more broadly about renewals are coming to the communications toolkit. This will include social media posts, one-page flyers, and some ads about coming availability of the one-way text messages for enrollees. We'll be adding these materials to the toolkits in the coming weeks. However, these digital banners are posted now. Design files for the banners have been posted so you can co-brand them. Health plans may also want to modify or delete URLs to provide for their own possible renewal web pages. Just FYI. Last week, DHS distributed a news release. And can we post that news release in the chat? I can do that at the end too, if Helen, you don't have that link. But last week, DHS distributed a news release on the resumption of renewals. It discussed that renewal forms went out to our first group of renewals, about 100,000 Minnesotans on medical assistance. It highlights the importance of updating enrollee contact information and directs people to the Renew My Coverage webpage as their one-stop shop for all info on renewals. The news release is available in 5 languages to hopefully encourage publication in diverse media outlets. And it's also available for you to use in your newsletter or any email communications. And we received, so that's the end of the public health emergency and unwinding and how renewals will be working. We also received a couple questions from Laura beforehand. And so I'm going to move into 2 of those, and then we're going to have somebody else tag in for the other questions. And I think at the end we'll open for all questions. So one of the questions that we got from Laura was, does Minnesota cover undocumented persons beyond the pregnancy and postpartum period? And how does this relate to renewals? So during the unwinding, renewals will be conducted as they were prior to the public health emergency. So a lawfully present non-citizen is a citizen who has been granted the right to stay in the United States and has not violated the terms of their agreement. So as you can see, kind of by the 4 categories for medical assistance, we have U.S. citizens, U.S. nationals, lawfully present non-citizens under 21, lawfully present non-citizen pregnant women, and lawfully present non-citizen with a qualified immigration status. A qualified immigration status means different things for different immigration statuses. It's actually pretty complicated. But some immigration statuses allow a person to be eligible for MA as soon as they're granted that status, such as a refugee or an asylee. And other statuses require a 5-year waiting period before the person can be eligible for MA, such as a lawful permanent resident. So if somebody has a qualified immigration status, they could be eligible for MA. And if they're a lawfully present non-citizen who hasn't quite reached that 5-year waiting period, they'd be eligible for Minnesota Care in the second column. So Minnesota Care, we have our US citizens, US nationals, all lawfully present non-citizens, and then those who have an immigration status of DACA. For our CHIP funded medical assistance, we have undocumented non-citizen pregnant women. And then lastly, undocumented citizens are eligible for medical assistance, emergency medical assistance. A person who is undocumented can be eligible for EMA if they have a medical emergency. EMA coverage only lasts for the period of the emergency. So for example, EMA will pay for labor and delivery services for a pregnant woman if she does not qualify for MA or CHIP funded MA, but it wouldn't pay for, there's no postpartum period for an emergency medical assistance eligibility for someone who's undocumented and doesn't qualify. It only covers that medical emergency. One of the other questions we received was about continuous eligibility, the legislative proposal that's ongoing. It said, how does the current proposal for 12-month eligibility up to age 6 impact the unwinding process? So currently there are 3 prongs to the legislative proposal for continuous eligibility. We have continuous eligibility for children under age 19 for 12 months, which will be effective January 1st, 2024. That actually came down in a federal law recently, which is why that effective date is a year earlier and is just a few months away. And then we are applying for special permission if we get the legislative proposal is passed. Then we'll go on to ask the Center for Medicaid Services if we can do continuous eligibility for children under age 6 for up to 72 months. That would be effective January 1st, 2025, as well as continuous eligibility for children age 19 and 20 for 12 months, also effective January 1st, 2025. So renewals will be continued to be processed as they were prior to the public health emergency. Once a child is determined eligible for MA, they will continue to be eligible for MA until their next renewal under continuous eligibility policies, regardless of income and household changes. So if that policy becomes effective Jan 1, 2024, all of those in the January renewal group will get the benefit of that continuous eligibility. So if you're determined eligible in January 1, 2024, and you're under age 19, you are guaranteed to have MA eligibility until your next renewal, unless there are some exceptions, moving out of state, voluntary request to terminate your coverage, death, and you age out. So otherwise, with those normal income, household changes, you would retain that continuous eligibility until your next renewal. At your renewal, we would look at, are you still eligible for MA? If so, you would get another 12 months. And if not, you would move to another basis of eligibility. So from renewal to renewal, that coverage would be protected. And that is how continuous eligibility for children would work during the unwinding period. It would be starting 1/1/2024. And then once we got permission from CMS, starting 1/1/2025, continuous eligibility for children would be if they were determined eligible for MA, say at age 2, they would essentially get all the way the next 4 years of MA coverage protected. They wouldn't even have that 12-month renewal check. They would just say, as long as they're still a state resident, as long as they haven't requested termination, they would get that protected eligibility for up to 72 months or until age 6. I think our next, I think Flower, are you on? Did you want to take these next 2 slides? I can continue running the slide deck if you want.
Oh, yeah, that'd be great. Thank you. I'm sorry, Gina and Flower, this is Laura.
Yeah.
Do you mind if we pause to see if people have questions about those 2 policy issues we have? I think we are still good with time. So I just want to make sure, because that was a lot of good information in a very short amount of time. So do you mind?
And I talk a little fast, so.
No, that's okay. That's okay.
I'm happy to take questions.
Yeah. Do you want to start with the undocumented persons first?
Sure.
So the reason, just I'll tee this up, and thank you for covering this question. When you joined us, was it a year and a half ago, Gina, and we talked about the extended postpartum period covering undocumented persons as well. We know that there's a lot of concern with families in who have mixed documentation, and concern that even if they come forward and try to get the medical assistance and healthcare coverage, that they'll be reported in other ways. So that's one concern that we continue to hear about, and I know that our family home visitors have been trying to help families navigate and manage. If you do know, I know you're the healthcare policy specialist, and you may or may not have all the answers here, but can you speak to any types of protections that families might have, and how and where this data would be shared so that home visitors can help reflect that to the families they're working with?
I can tell you what I know, which is that as Medicaid data is not allowed to be shared. And I'm not sure if you remember, but during a few years back, during the Trump administration, they published a rule saying that they were requiring states to share Medicaid data to determine if somebody was, I forget the term, they were wanting to share to make sure that they weren't becoming like for sponsors, that the sponsors would have to pay for everything. No, I'm not saying it correctly. And there's a term for it, I can look it up. But where federal law says that states are not allowed to share Medicaid data except for these number of reasons. And there was a rule put out during the Trump administration saying that states are required to share immigration data with the federal government for the purposes of for immigration purposes. Minnesota was actually one, I think, of 15 states that joined in a lawsuit against the federal government, saying that we actually are bound by federal regulation that we are not allowed to share this data. So currently, and then when the Biden administration came in, they removed that rule and said that they're not going to be enforcing that. So currently right now, Minnesota doesn't, and we resisted any kind of sharing of Medicaid data. We're federally prohibited from sharing Medicaid data. We have access right now. Our IT system has access to be able to check federal immigration status to verify. If not, we work with folks to come up with some kind of paper verification of their immigration status. But if not, we have all of these, Minnesota has all of these buckets for folks who do need healthcare. So if you're like you said, if you're an undocumented non-citizen pregnant woman, you are eligible for CHIP MA. You get your postpartum period. If you are DACA, you're actually eligible for state-funded Minnesota care. President Biden just put out a rule. The CMS just President Biden just announced it, and then CMS just put out a rule expanding MA and Minnesota care to allow DACA recipients to be eligible, which is exciting. So there's a lot happening with expanding healthcare to more immigration statuses that are currently then available. But as the state of Minnesota, we don't share immigration status with anybody at the federal government. I don't know if that helps.
Yep, thank you very much. I think that's incredibly helpful. I know that as home visitors, you are trusted persons coming into someone's home and working in the community. And it's just helpful for you to have that information to share with the families that you're working with. And I know this is, it takes a lot of trust in you. And I want you to have the best information possible, or your teams to have the best information possible when working with families on such sensitive issues. And then if I could just say, we have through the coalition, we've heard from some home visiting programs. Most of them were non-county staff who we've heard this information from. So we understand that there may be some counties across the state of Minnesota where there is less desire from the elected officials and or county administrators to make public services available to all community members, whether they're undocumented or newly arriving families is really where we've been hearing some of these anecdotal experiences. So if you are running into these concerns where you feel like families are not able to access this information, we have been working directly with some of our community partners and connecting you with state resources when your county resources don't feel like a safe place for families. So I just wanted to put that out there. That's one of the spaces that the coalition has been trying to help bridge whenever possible. So that was my questions about this. Do other people have questions before we move on in this area?
I have just one question, and it related to some of those anecdotal stories. Do you have some of those like already like developed, like those scenarios or those stories? Because I think just going back to when I was a home visitor, I think having some of those stories or those examples like that you start to memorize after you've shared them a number of times can be really helpful tool. Otherwise you just left to your own devices to kind of make up a scenario or which could or could not be a good example of something to share with a family and could lead to more anxiety or intrepidation. And also they're hearing their own stories. So there's something I think important about being proactive with that.
Carrie, we have not put together documents for home visitors, but we can definitely work with our team here at DHS to, again, like establish what some of those rules are and make sure we make them available through our website too.
Laura, I just wanted to add, I think that's a great idea, Carrie, especially sort of case stories or case examples, and then use that to help in your conversations. And so Gina, I'm actually looking to you, and there's so much great information that you've shared. We want to make sure that we document that information and maybe create a scenario that again, family home visiting programs can take and be able to reference. So I think there's opening up some opportunity for us to collaborate and create some really additional meaningful resources for you all.
Definitely. I also have a chart of who can be eligible for what, if you're interested in that.
That would be great. And then can I just say one more thing, if you want to go to the next slide, and then we'll be able to turn over to Flower unless there's a few other questions from anyone else. Is I wanted to also just highlight or ask the question for clarification. For the continuous coverage, the new federal law and then the potential state law, are you encouraging people to communicate that these are coming forward? I'm just thinking about, it's like the families who are up for eligibility July through December in 23. Is it being communicated to them specifically that it'll be changed to a 12-month eligibility starting in January? Or has that not been included in the communication? And then I'm wondering out loud for my home visitor partners, does it make sense for you, if you're talking about eligibility, to also share, there is the new federal law that allows 12-month eligibility, and then once we know if the up to age 6 eligibility passes, then you would be able to add that to your communication toolbox.
Yeah, I don't know. I think we've been so focused on the unwinding period and just getting everything, we kind of had our regular MA rules, then we had our COVID rules, and then we kind of have these modified unwinding rules before we go back to our pre-COVID rules, that there's just been so many changes and moving pieces at DHS. So we're trying to get all of these, not only things that can help enrollees renew, but also that CMS is requiring us, everything's getting to place, that I don't think that there's been much communication about this, especially because the legislative session isn't over. I would anticipate that once, and like I agree with you that I think that this is very likely to be passed, especially because it was up last year, became very close to getting passed last year, and it's in both the House and the Senate this year, that I think there's a good chance that it's going to be passed. And I would anticipate that a lot more correspondence is going out to enrollees after the end of the legislative session, once we have kind of some more concrete approval.
Great. And then maybe Gina, do you want to respond to Daniel? Daniel, I'm not sure if you heard Gina's comment about your question in the chat, and then we can tee you up, Flower, if there's no other
Question, because the Biden administration undid the ban on sharing information with INS on immigration status that was implemented by the Trump administration, is it possible that future administrations could reinstate the rule? It's possible, because it was, rules that were out of the White House, as opposed to like a law that was, we have federal law that says Medicaid is not allowed to share certain data except for these, certain reasons, and immigration data is not on that list. So it's possible that that rule could be reinstated, but prior to the rule being rescinded by the Biden administration, Minnesota and 15 other states had joined in a lawsuit against the federal government to oppose that rule, saying we have conflicting federal guidance that says we can't do that. And this White House rule is, the federal law is obviously going to trump that. So I think that while it's possible, I think it'd be even more likely then, if that was reinstated, that the lawsuit would be reinstated and it would require some kind of federal law change, which is much more difficult to pass than just a rule that was promulgated by the White House.
Okay, well then let's keep moving. We'll continue moving on. There
Okay.
are no other questions.
And I can always pop in later after Flower does her 2 slides. Or a couple slides.
Perfect. Thank you, Gina. Well, as Gina mentioned, that there are multiple languages that are offered. And as you know, for the program notice that went out, there are 6 different languages available in 6 different languages: English, Hmong, Russian, Somali, Spanish, and Vietnamese. And I've linked them here as well. And for U.S. partners and providers, you can find them also in the communication toolkit that I believe Helen did put in the chat as well, and additional information in the Renew My Coverage. There's also a link on the slide here that gives you direct link to those forms, the renewal forms itself. And so that was the question, one of the questions about written languages and how you can access those forms or materials. And then the next slide, for member assistance, you can direct them to or refer them to the county tribal offices, certified navigators, as well as the healthcare consumer support. And I will put all of that information in the chat as well, with links to those resources for members that you can provide to them. Oops, sorry, I guess it didn't come through as links, sorry. And then I will hand it off to Angie, and she will cover this one while I get those links into the chat.
Hello and good morning. My name is Angie Wassman. I've been with DHS for a little over a year now as a provider trainer, but previous to that, I worked on the provider side of things. And I'm just going to go over a little bit about what partners and providers can do to help with program eligibility renewals. The state needs your help getting the word out about restarting renewals to help Minnesotans maintain their coverage. Providers have a unique and trusted relationship with members. So we're encouraging them to help spread the word to their members. And since many Minnesotans and families with public health care coverage have never been through the renewal process, the importance of a clear and consistent communications cannot be overstated. So what can be done now? Since renewal paperwork is being sent by US mail, updating the members' contact information is the most important thing that they can do right now. Without an accurate address on file, the renewal packets cannot be delivered. Also, understanding the renewal cohort cycle, I think that Gina went over a little bit earlier, is also important. It helps determine timelines for when they should expect the renewal information by mail based on the anniversary of their renewal month. We have created a web page to bring all these resources together for partners, providers, and stakeholders, and what their role is in the unwinding process. That web page can be found here on DHS provider role and unwinding webpage that I've linked in this PowerPoint. I do recommend bookmarking this page as it will be updated with additional resources and new information as it becomes available in the coming weeks. So.
I know that was a ton of information to throw at you guys in a hour or so, but we're happy to answer any questions. If you have anything else that you've thought of, and of course, you're always welcome to email if you have follow-up questions after the meeting.
This is Nancy Jost, and I do have a question. So I'm not a provider of services. I work for philanthropy. And so I was wondering, out of all this information, what thing could I help with and others like me who, so I work with communities, then work with people, families. So what could I do to help spread the word?
So you, I think, so you talk to families specifically?
No, I don't talk to families. So we have early childhood initiative collaboratives in each of our counties. And a lot of those people work directly with families and children. But how can I help them get this message out to people? So it's kind of a step away from families, but I still think maybe I could help with that. And just wondering, out of all of this information, what would be the thing to share?
I think if you could help the people who do have access with, kind of make sure that they're aware of, some of the communications toolkits, some of the information that we have, the flyers, the postcards, watch for the circle in blue when it's time to renew. You're going to get this blue circle. You need to make sure you complete this renewal paperwork. You can, if it's difficult, you can work with a navigator. You can mail it in, fax it in, you can call and complete your renewal over the phone, as well as there's an easy document upload on the Renew My Coverage webpage. I guess just making sure that everyone has the information that they need to be able to help people know that the renewal is coming, and that after 3 years of no renewals, we are starting the renewal process again. And I think the toolkit was linked, but anything you can print, send, email, I think would be very helpful if you could get to that. And then, like I said, they all come in different languages. So.
Okay, thank you.
I would also add to that too, Gina, if you don't mind. Just that provider role and unwinding webpage does have a lot of really great resources out there. So it links you to a lot of different available websites and information about the renewal process.
I'm wondering if also, this is Laura, Helen, when you and I were speaking, you had talked about navigators. Does it make sense for a community foundation that's regional to access some of the navigators in for Nancy up in North Central Minnesota? and invite them to come and share this information with some of their smaller community networks.
Yep. I think that's a great idea, Laura. And I was just going to respond to Nancy. I think, as was already kind of shared, I think there's a lot of information here through this PowerPoint, and then the resources that we provided linkages for that you can yourself just share with the early childhood collaboratives you're working with. The other opportunity, though, is this is part of the outreach effort that we're trying to really accelerate. And so in partnership with Laura, you could connect with me. And if you have those groups of, whether it be navigators or through the early childhood collaborative network, they're the ones that are going to be interfacing with families. And so the more information that we provide them and the more that they can feel confident, I think that's the way that we can help families. And so there's an opportunity for us as well to help support you in getting the message out.
Thank you.
Are there any other questions, especially those of you who, not especially, but for those of you who are working directly with families, are there things that you think would be helpful for us to work with our state partners to develop or consider as we move forward?
So I just wanted to say from our end, we sort of have tracked the case stories as a potential additional resource. So we'll keep that going internally and talk about how we can maybe create some of those stories. I'm not sure how, but I think it sounds like it would be a very helpful resource for the work that you all do. So more to come on that.
Great. I will, if it's all right with our DHS team, save your slides as PDF and then include them when I send out the recording. Is that all right with you? Yep. Great. And I'll make sure the links that are in your slides work so people can access them. So wonderful. And if people have follow-up questions on this topic, do you want them to come to you directly, Helen, or do you want them to flow through us to you? What's the best way for us to stay in contact? Or we still have our health department team here too. So not to overwhelm them all, but but we might also utilize that partnership at the state health department.
Yes, definitely. I agree. I think there's going to be a lot of hands on deck and all of us collaborating together. I will put in the email contact for community relations. Okay. And so we have a general email box that I think you can submit and then we'll respond to those inquiries. So I'll put that in the chat. Thank you.
I just wanted to thank you, Helen, Gina, Bauer, and Angela for attending today and answering so many questions and wonderful PowerPoint and good information we can take forward to our family home visitors. Thank you.
Thank you very much. Look forward to coming again and continuing this partnership.
Great, thank you. I think we just have the last couple minutes if we have partner announcements that anyone would like to make.
I would like to have you mark your calendars if you're interested in attending the Start Early Funders Coalition 2023 legislative briefing, which is going to be June 12th. And we are like this close to securing the Science Museum of Minnesota for that event. I'm touring tomorrow. So the invitation will go out, I believe next week, 16th, I believe. So certainly, Laura, if you want to forward that on to coalition members, we will be doing a full review of what crossed the finish line as it pertains to early childhood education. And we will have some time to hear from some legislators who have been really key to getting across the finish line. We will be honoring some legislators as well as some community advocates who have really shown up in big and meaningful ways during this legislative session. So it'll be part informational, part celebration, and we'll be looking ahead to what we might have to rally around and have a united voice for in the 2024 session for those things that maybe did not make it across the finish line. So that is an in-person event, and more to come.
Probably don't know this yet, Carrie, but any time range on the 12th?
I believe it's going to be like 10 to 11:30 is what we're looking for. Yeah, just enough to give folks time to travel in if they want to, and a little networking time built into that. And then make sure we release everyone before our tummies start growling and it's lunchtime. So yeah.
That's great. Thanks, Carrie.
Yeah.
Great. So that is the 12th of June.
Yeah, June. Yeah.
Wonderful. Okay.
We're
And
not
will you be recording
anticipating a
that?
special session, right? No, I don't think it'll be recorded. We're really trying to keep it simple. Maybe some people will record some speeches on their phones, and maybe we'll have some stuff to share out later, but really trying to keep it simple and crossing our fingers that there is not a special session, right? That we actually do finish when we're supposed to finish this year. So, which we have heard on good authority from a number of folks that it's going to end on time. So, well, let's hope that that's the case. Otherwise, we won't have much to share on the 12th, or we might have to revise the date. Who knows? So more to come. Thank you.
It would be historic if they finished on time.
Yes.
Love the process, but it's not always efficient. Okay. Any other updates?
Not an update, but just seeing a lot of new faces on the call. So I'm gonna do a quick, I apologize, some shameless promotion here because Kathy, my boss, is on the call and I gotta work for my dinner. But we are the Birth Equity Community Council out of Ramsey County, and we're so lucky to have this partnership with the Minnesota Coalition of Family, not the partnership, but to be involved in the Minnesota Coalition of Family Home Visitors and have them involved in our work. And so for all you new people, we would love to also have you, I've been taking notes on all the stuff and saving your links. And so those will go out in our Birth Equity Community Council newsletter. And I'm going to we have a link now where you can add yourself to our mailing list for those future meetings. And we are a coalition of birth equity providers throughout Minnesota as well. So I'm going to put that in the chat if you want to subscribe to our mailing list and keep updated. Sorry about the shameless self-promotion. All of the links that you guys shared in the chat, I will be putting in our newsletter. So I hope that nobody's mad at me for stealing those. But yeah.
Way to go, Taylor.
Yeah.
I did add in the chat, it is the first time ever in Minnesota that we are celebrating Doula Appreciation Week. So the governor put forward a proclamation, and there was a beautiful celebration this week for all the work that doulas do to help improve birth outcomes. We, through the Family Home Visiting Coalition, have been partnering with them for the last several years. So it was really lovely to see them being celebrated and know that there are a number of family home visiting programs that are really looking to incorporate and partner with doulas to improve birth outcomes. So there's been some exciting synergy around that work as well. We have a couple minutes left for a few more announcements if anyone likes. Otherwise, you can take some time back. Okay, we will commit to getting the slides out and the presentation out. Hopefully by the end of the day tomorrow, we can get this posted. We usually save or share these recordings from our YouTube site. So you can always subscribe if you'd like, or you can just view it upon receipt, either one. So you can track it that way. And then we also will be sending out highlights at the end of legislative session on what passed. So you'll get another email from us, a few more communications this month. But we want to make sure you're tracking that with us. And then we are not scheduled to meet again until, goodness, I should know this off the top of my head, I think in August. But please watch for email communications because we'll be sending out registrations for the bias and racism training and its impact on maternal child health, as well as round 2 for anyone that participated in the first training series. Kathy or Molly, anything else?
I just want to say thanks, everyone. This was a great meeting, lots of great information, and I really am looking forward. I know that sounds silly, but looking forward to the follow-up and really working with families in all the ways we can to get this information out to them. So thank you, everybody, for your participation and good questions. And I hope you have a lovely rest of your day.
Yep. Thanks, everyone.
Thank you.
Have a great day, everyone.